Good morning. I'm Dr. Vincent Zubowicz with Thrive Med Spa in Milton, Georgia. We do aesthetic surgical procedures on people primarily for one reason, and that's to make them feel better about themselves. There may be some ancillary reasons from time to time, but for the most part, we operate hoping that in the end, the patient is pleased with the result and feels much better about the fact that they've gone through the operation. Now, there's three possible outcomes in general when we do this. The first is where the operation is successfully performed and the patient has a good result, which is 95% of the time or even better. If it were less than that, I wouldn't be doing this. But here's an example of a patient. This is pre and post-op. And then you see pre and post-op on the lateral. Now, this is a journey. So after we do the successful operation, I have to guide the patient through the convalescence because I've seen hundreds of facelifts, and most of the time this is the first time they've seen and certainly experienced a facelift. So the management is primarily psychological, but in these situations that's actually fun surgery. The second possible outcome is that technically the operation goes well, but there may be some advent in the healing process that creates something that's aesthetically less than perfect. In this patient, we did a facelift, and the scar around the ear was, in my mind, unsuccessful or unsatisfactory. And for that reason, I really strongly push the patients to allow me to try to do a revision. Most of these you can do successfully in the office with a little bit of local anesthesia, and generally the patients are very happy, even though at the end of that trail of convalescence, they have to jump over a little hurdle. The third and fortunately very rare outcome is when we perform a technically excellent operation, but the patient is dissatisfied with the result. And even though I've technically succeeded, I consider the process a failure because, as I said earlier, we're here to make the patient feel better about themselves, and if the operation doesn't achieve that, then as far as I'm concerned, it's a failure. And we do talk to the patients at length preoperatively, looking for psychological issues or other things that might have brought the patient into the office rather than just an anatomic feature that they want to have changed. And most of the time we can unveil that, but occasionally we don't, and we're stuck with a patient who still has the same emotional issues. They do look differently, but they don't feel better about themselves because of the operation. So the patient's still my responsibility, so they come to the office as often as they want. They can levy their concerns and their disenchantment with the process, and we just let that play itself out until the patient's satisfied.